It's a call that's telling me I'm here to serve. It's a need to make a difference in the world. 24 hours, day or night, these healing hands will make it right. Looking in their eyes, I know that I'm changing lives, changing lives, changing lives for the better, changing lives.
Hello everyone, I'm Grace Sells along with Jim Knox, and welcome back for another edition of Best Docs Network, the show that's featuring some of the best doctors in the Dallas-Fort Worth area that are really changing people's lives.
And speaking of helping change people's lives, we'll begin the show with minimally invasive bariatric and general surgeon Preeti Malladi, who helped one former Marine overcome diabetes.
Well, I had been a diabetic for over 10 years. I had colorectal cancer, and the good news was that they caught it early, they treated it, but the result was I was starting to gain a lot of lymphedema in my legs to the point that my calves were about the same size as my knees, maybe a little bigger, and I was having a lot of problems getting around. So with diabetes, you want to move, you want to exercise, that's how you lose weight, and I couldn't move or exercise, and it seemed like I was in this downward spiral, and I didn't want to be in that spiral anymore.
So Mr. Leslie is a great patient, very educated. He had done a lot of research on the internet, had done a lot of reading. He's a teacher, and he came to see me because he had done his reading and he knew that bariatric surgery could help him with his diabetes. What's really exciting about bariatric surgery, and particularly the gastric bypass, is that it can almost cure diabetes.
For me, it was not a cosmetic procedure. As far as I was concerned, it was a life-saving procedure because I went from over 250 pounds to right now right around 160 pounds.
And he has resolved his diabetes, he's off of his medications, and he's doing great.
When I was in my 20s, I spent some time in the U.S. Army and got in the best shape of my life. I'm down to that same weight now. I have energy, I can exercise, I can do all of the things that I didn't think I would ever do the rest of my life. I walk around my classroom, whereas before I would sit behind a desk and watch students, and then when they had questions, they would have to come to me, and instead now I go to them. When we were, as the teachers, as we were doing things, we decided that we would do a group building exercise and play a game of kickball with each other. And so this summer was the first time I really started playing that game, was the first time I really ever sprinted. So I was in right field and somebody's kicking the ball and I'm running so fast, my brain's going, you don't know how to run this fast. You better slow down before you fall. And the next thing I know, I would fall flat on my face. Everybody's going, are you okay? Are you okay? And I'm laughing because it felt so wonderful to be able to run. And yes, did I fall? Yes. Did I scrape my knees? Yes. But can I run? I can move. That was fun.
BestDocsNetwork.com helps you find the right doctor for your medical needs. Watch videos on each doctor and decide for yourself who fits you best. On the Best Docs Network homepage, you can see the latest videos, search for a doctor, find educational content, and watch the latest TV episodes from each BDN market. Physical appearance plays a huge role in our self-confidence. Up next, we're going to see how plastic surgeon Dr. David Azouz was able to help Carrie feel more confident and comfortable in her own body.
Carrie is a young lady who complained of breast hypoplasia, which means small breasts. Her breasts were small and she wanted larger breasts. She also had breasts that were not what she thought was normal because she had a tubular breast deformity. What that means is that the nipple was very, very prominent and pointy as opposed to a more natural appearance. So she wanted breast augmentation, larger breasts. She was an A cup and she wanted more of a CD cup. And she also wanted to correct her tubular breast deformity or the prominent nipples that she had.
It was just something I really wanted. I wasn't comfortable with my body at all. I couldn't wear bikinis at all. I couldn't talk in public. So I just thought if I get the surgery, that it would help me out. When I first met Dr. Azouz, I thought He was very friendly and was always smiling, and that would make me smile and feel more comfortable. And he explained everything perfect to me.
Tubular breast deformity is quite common. Many women have a tubular breast deformity where the nipple doesn't sort of lie flat on the breast and is very prominent. In very severe cases, the breast looks like a tube with a pointy nipple on the end. So the object is to make it rounder, to give them cleavage so they don't have these pointy breasts. In Carrie's case, what we did is a correction of her tubular breast deformity, and we also gave her increased volume.
At first I was an A cup and now I'm a 36D, and I just love that. I was surprised I couldn't stop staring at myself in the mirror, looking at the new me, and I would just stay in my room and just keep looking at myself, and I would turn sideways and all that. I love going shopping now. I really do. Because you can wear whatever you want without worrying about if the cut's too low, how you're gonna look in it. I love wearing different stuff now. The dresses, the bikinis, everything. I just love it.
Coming up next, learn about your options when testing for cancer during our Medical Minute.
Plus, we'll hear Dr. Jason Williams talk about minimally invasive procedures to treat back pain. All this and much more when we come back. Traditional MRIs cost a fortune and are uncomfortable, usually done in small, cold hospital rooms. But you have a choice. You can have your imaging done at Preferred Imaging in a comfortable environment with superior staff and technicians that make it simple and stress-free. Even better, Preferred MRI costs 2/3 less than the traditional hospital MRIs. And with 18 state-of-the-art locations, it's easy to find one near you. Call now to find out how you can save on any of your imaging needs. Preferred Imaging. Imaging made easy.
Best Docs Network doctor and official eye doctor to the Dallas Cowboys, Dr. Harvey Carter, the expert for all your vision needs. See the world differently in only a day. Specializing in LASIK, cataracts, and crystal lens. Visit Dr. Carter today for the ultimate eye experience. Call now and receive $2,000 off your LASIK procedure. When seeing is believing. Dr. Harvey Carter, the official eye doctor to the Dallas Cowboys.
To find a doctor on bestdocsnetwork.com, you can search by your location and the doctor's specialty. From there, you can search through the doctors listed. You can even search by your current location to find the doctor closest to you.
I'm a yoga instructor and fitness instructor, and I've had 3 babies. And after having all 3 babies, I started to realize that no matter how hard I worked, no matter how much weight I lost or how much muscle mass I put back on, I wasn't seeing some of the changes that I wanted to see.
When women have children, their muscles and their abdomen separate, and they sometimes don't come back. And so what happens is that's how they get the little pooch in the lower abdomen region, and it stays there for life.
Before I met Dr. Thornton, I didn't know what I was going to need to have done in order to feel like myself again.
She had a very interesting problem with her abdomen, meaning that she didn't have a lot of skin to remove, but she had a huge separation of her muscles.
He convinced me and explained to me the things that I needed to do, and that no matter how much fitness I did, I wasn't going to see the changes that I wanted to just because of, having 3 babies and what it does to your body.
I came up with a plan with her. It's called an umbilical float. You can't force that procedure on everyone, and you have to pick that person exactly. And Taya was the perfect person, so she had a mommy makeover. With her, I did the minimally invasive tummy tuck, where I just make a small incision in the bottom, and I release the belly button, and it allows it to float upward. And then I go all the way up to almost near the breastbone, and I sew up her muscles all the way from the breastbone all the way down to her pubic bone. And that literally brings her abdomen back into its normal alignment, so it gets real tight. And then I just stitch her belly button exactly back down where it was before, and then I pull out the excess skin. Well, good candidates in particular for mommy makeovers are just women who are between the ages of 35 and 45. That's kind of our average, that have grown kids and now they want their body back. Usually it's some sort of breast revision surgery in combination with abdominal revision surgery. So when you're done, they have improved breast and they have improved abdomen. And that's really what the mommy makeover is.
I am so glad that I went with Dr. Thornton. I'm so glad that I had this procedure done, because I feel like myself again. I now feel like I look how I feel. It was probably the best decision I ever made.
Well, Jesse came to me complaining of low back pain and leg pain. It had been plaguing him for several years and been progressively getting worse. It was to the point where it was affecting his job.
Every time I had a back spasm, I'd be out for 2 or 3 days where my back would hunch over for, I'd be stuck in this weird, awkward sideways position, hunched sideways. And every night when I went to sleep, I dreaded going to sleep because I knew I'd wake up in pain. Sure enough, it was a bulging disc on L4 and L5. Well, initially, and my doctor referred me to a spine specialist that he was familiar with and comfortable with. So I saw him for a while. I went in for cortisone injections. Went through that, went through physical therapy, and all of it helped, and it did help alleviate some of the pain, but it eventually came back. So the doctor recommended actually having some type of invasive surgery. And it was something I just felt really wasn't comfortable with. And luckily, at that time, Dr. Williams told me about the Acuriscope procedure.
The Acuriscope procedure is a minimally invasive spine surgery that addresses conditions of the spine, including herniated disc, bulging disc, degenerative disc, and/or scar tissue in a patient's spine.
The way he presented it was, here are the facts, here's what's been done on other patients, and here's the proven success rate.
Oftentimes patients come to me, and they're in so much pain and have their extremities affected so much that they can't walk without using an assistive device. That'd be a wheelchair, a cane, a walker. Upon doing the Acuriscope procedure, a lot of these patients no longer need an assistive device.
When I woke up from the surgery, I knew that it had worked. There was this weird feeling of intense pressure gone from my back.
After Jesse had the Acuriscope procedure, he followed up with me, and I determined that Jesse's pain was 100% gone.
I have now been able to focus more on work, focus more on and enjoying my family, getting just good quality sleep. I've been pain-free for 9 months now.
Wouldn't it be great if we had a blood test that could tell you if you had cancer or you don't have cancer? Well, we don't quite have that yet, at least for most cancers, and in the future we probably will. I would say within 5 years there will be tests that we can do on your blood that will tell us if you have a tendency towards certain cancers or if you even have cancer cells in your body. There's a lot of genetic testing and a lot of research going on, so there's great things are going to happen. Now, as it is now, there are certain tests, for example, for ovarian cancer. There's a test called CA125. You don't need that test unless you have a strong family history of things like cancer of the uterus or ovary cancer in your family. However, it is a good test and can tell us if that cancer is brewing. There are certain tests that help us with pancreas cancer. But in general, the blood test that you have when you do your physical give the doctor a clue as if you are at risk for cancer. For example, you might be anemic, or your platelets, which is part of your red blood cell count, may be high. There's also other things like liver tests that may be elevated and that indicate your cancer risk is high. So get your blood test done, check it out, and hopefully in the next 5 or 10 years there'll even be better blood tests.
For additional medical minutes from Dr. Honaker, log on to bestdocsnetwork.com and click on the Medical Minute tab on the home page.
For more information about any of the outstanding doctors you see on today's show, even request an appointment, head to the website, bestdocsnetwork.com. That's bestdocsnetwork.com.
Now up next, we're going to see how Dr. Naila Malik was able to help Jennifer avoid going under the knife for firmer and younger looking skin.
Aging is a multidimensional process which starts in the surface and involves subsurface structures including skin, fat, muscle and bone. So the way we determine the best treatment for anybody's aging phase is by looking at the extent of aging they have in each one of those layers. The CO2 laser will address your skin surface problems like texture and fine lines and deep lines and some collagen and elastin production. The radio frequency will address the skin tightness below the skin, and then you can use dermal fillers such as Radiesse or hyaluronic acid fillers to account for the loss of fat that occurs with aging as well. It is important to know what your patient needs based on their face shape and the type of aging you have. When I saw Jennifer, she originally came in asking for an option of a filler for her fine lines and deep lines above the lip and nasolabial folds. But after examining her, I determined that the CO2 fractional laser was probably the best choice for her. And she had the added advantage of having a tremendously great response to the CO2 laser by improving her elasticity.
My only knowledge of cosmetic procedures was filler and Botox. And I was told that I would probably need a facelift a few years ago by someone else, and I was dreading the thought of going under the knife, and that wasn't for me. So I was very thrilled when she told me this is basically a facelift. And sure enough, I had it 5 days ago, and I am absolutely thrilled with the results. And what's even more exciting, she says the results are even better as you go a few months down the road. So I'll continue to see improvement. I am completely blown away that for as simple of a procedure that it is, it has completely changed my life.
The response of each individual patient to these treatments is very, very different. It depends on their genetics, on their lifestyle, and so many other things, the amount of stress they may have at that time. So you cannot really have a cookbook that every patient is going to need the CO2, radiofrequency, and dermal fillers, even if they look the same at the first visit. So you really have to step back and look at their results and see how the results show up over the next several weeks before you decide to do a second treatment.
Hi, I'm Dr. Preeti Malladi with Best Docs Network. Did you know that obesity can increase your risk of sleep apnea and that bariatric surgery can help? To learn more, watch my videos on bestdocsnetwork.com.
I came to Dr. Lewis because I always wanted to have really white teeth, and my teeth were straight. I never had to wear braces, didn't have any of those issues, but I had extreme sensitivity. So I could not use any of the whitening strips or just the gels that anyone could. My gums were receding probably because I am one of those brushers that brush the wrong way, didn't do the circular motion.
She really wanted veneers. She had just gone through a lot of personal stuff, and she wanted to make a change in her life, but she really did not want her teeth touched. She did not want anything reduced on her teeth or anything prepared.
So he sort of walked me through the process, and I found out that what he could do was I didn't have to have any, didn't have to have my teeth all filed down. They just sort of buffed them, and he just recreated sort of my smile. It's really strange because it didn't change a whole lot, but it did change a whole lot.
So we did the set on her, and they turned out beautiful. I've done thousands of them, and people are very happy with them. And what we found out is, in most cases, they're stronger. Even though they're very thin, they're stronger than regular veneers because the strength isn't derived totally from the thickness of porcelain. I mean, you have to have a certain thickness, but it's derived from the bond to the tooth. And we found that when we bond to the enamel, which is the natural outer layer of the tooth, that we get a much stronger, much harder veneer.
Just the craftsmanship was amazing. I mean, it was like going to a Da Vinci or somebody, because it was such tiny details, but it really changed my smile.
So in actuality, not only are they, less destructive to the tooth, or you don't have to take anything off the tooth, but they're also stronger, and so they look great.
It was painless. Came back, put them on, was getting my hands massaged during the whole process, and I walked out and I had a perfect smile that looked natural. I enjoy smiling, and I love having people say, "Oh, you have the prettiest smile."
Still to come, we'll learn about the benefits of cinnamon and how it's good for your body.
Plus, we'll hear how Dr. Yadro Ducic provides exceptional skin care to his patients. All this when we return.
Imagine designing your own perfect face and body. Turn to Dr. Robert Wilcox, who specializes in face and body procedures as well as many non-surgical alternatives. Dr. Wilcox understands that your life and appearance matter most. With an extensive educational background and exceptional eye for detail, you can now look as young as you feel. Call for a complimentary consultation and regain your confidence today.
Do you have missing teeth, need crowns, veneers, partials, dentures, or a full mouth reconstruction? Prosthodontist Dr. David McFadden will give you back the youthful appearance and confidence you deserve. Backed by credibility and credentials, Dr. McFadden is cosmetically changing his patients' lives one smile at a time. Call today or log on to dignitydental.com. Dr. David McFadden, your go-to dentist in the Dallas-Fort Worth area.
Each doctor on the Best Docs Network website has their own profile page where you can watch videos on the doctor, read info on their background and training, find their office locations and directions, as well as ask the doctor a question and request an appointment.
So before I met Dr. Ducic, I just felt like my skin was dull and spotty and splotchy and was constantly trying to search for makeups that would make a difference transitioning into my 50s.
Skincare is obviously very, very important. The skin is what everybody sees. They don't see the underlying bone. If we do somebody's rhinoplasty, they're not looking at their cartilages, they're not looking at their jaws, their cheekbones, their eye sockets. They see the skin. That's the first thing that you see. So ideally, you want the skin to look as good as possible.
Typically, Dr. Ducic does like me to see patients before they have surgery. He'll do a consultation and he'll send me in the room and say, please talk to them about skincare. Let's get their skin looking good first, and then we'll, discuss surgery.
I always feel at home with Jennifer. She is a very well-versed in skincare, and she pays attention to my age, and we stay really focused on what it is that I'm trying to accomplish.
Well, the whole point of doing cosmetic surgery on somebody is to make them look better and feel better about the way they look and more comfortable in their own skin, so to speak. And so one of the first things we always try to do is tune up the skin, make the skin look as good as possible, because then people oftentimes are so happy with their skin that they don't feel like they need to sometimes even do surgery.
As you get older, your body you lose the collagen in your skin. Collagen's kind of like the springs in a mattress. You start to lose volume, and you'll start to notice fine lines and wrinkles. By stimulating the collagen, your skin will become firmer and the wrinkles will start to dissipate. There's several different things that we offer that help stimulate collagen, one of them being the Dermapen. It creates micro injuries to the skin, and when the skin starts to heal, it starts to rebuild collagen, which is pretty amazing.
And the goal is not to do surgery, the goal is just to make somebody look better.
I no longer have to search for makeups that cover up. I just feel younger than I thought I was going to feel in my 50s, and just feel brighter, and that my skin finally is at a place where it's glowing.
Having a baby can affect a woman's body dramatically, but thanks to plastic surgeon Dr. Robert Wilcox, he is helping women get their bodies back with the Mommy Makeover.
Well, Mommy Makeover is a term that incorporates recontouring and improving the body, in particular after one or multiple pregnancies.
Over the past 6 years, I've lost a lot of weight and have had a baby and just had a lot of imperfections that I didn't like about myself that made staying healthy difficult.
What a Mommy Makeover incorporates is usually a tummy tuck, which tightens the muscles and the skin and removes the lower abdominal stretch marks. And oftentimes there may be loss of breast tissue from the pregnancy and subsequent nursing, or there may be drooping in addition, in which case breast augmentation or a breast lift or the combination of the two is done in conjunction with the tummy tuck. And then there may be need for liposuction as well in, for instance, the hips or the thighs.
My concern is I'm a working mom, so I knew I couldn't take off several months after each procedure. So that was a big concern of mine, and I'm a respiratory therapist and I work 12-hour shifts on my feet, so I had to be able to be active when I came back to work. That was a big concern of mine. So Dr. Wilcox explained how he would divide up the mommy makeover that would best fit my schedule and my lifestyle. He definitely put me at ease over everything that would be done and what to expect after it was done and how it would look.
Looking in the mirror and not liking what you see, how more impersonal can that be? And now to look in the mirror and say, I not only look good, I look good for my husband. That's a knockout there.
Even going to buy a new pair of shorts or a sleeveless shirt. I used to wouldn't wear short sleeves or a sleeveless shirt, and it's just a freedom that you have to go think something's cute, try it on, and it does look cute. I am very pleased with the outcome and service that I got from Dr. Wilcox, and it is the best outcome that I ever could have thought.
Start sprinkling your oatmeal with some cinnamon. Studies show that this antioxidant-rich spice may reduce blood pressure and lower stress. BestDocsNetwork.com also has a video library of all the doctors' videos that you can break down by doctor, topic, and specialty. This is a great way to find videos quickly and watch all the videos associated with your needs.
I was very apprehensive about coming into Preferred Imaging the night before. I had read every negative thing that could happen when you have an MRI. So when I came in the door, the secretary met me, just smiled. And the technician for the MRI was just really helpful, very reassuring. I was so happy I'd come to Preferred Imaging.
So I had saw a physician out of town, and he had looked at both MRIs and was wanting to order a different MRI. And he preferred the one for Preferred Imaging better than the other one and asked me would I return here for the one he was ordering. So we did, and he was very pleased with the second one that I had here as well.
The setting, the waiting room, and the changing room all were really nice.
Their room is really painted pretty neat. It's very artistic and just kind of makes you feel like you're not in that normal cold hospital type feeling, just more of a warm type feeling.
The staff was uplifting and answered all my questions, and the procedure was so stress-free. The technician gave me a button to push if I needed help instead of wiggling my feet and trusting that somebody was going to see me. The first thing I did when I was inside the MRI machine was to test the button, and she immediately came and pulled me out and said, "What do you need? Is everything okay?" And I was like, "No, I'm just testing the button." And she was like, "Oh, that's okay. I just want you to know that I'm here and I'm watching you and you have the button." And so that was very reassuring. And then the procedure was just like they said. I had an absolutely fabulous experience at Preferred Imaging.
I also live 2 hours away, but I am in a small town and the imaging there is mobile and it's not very well. So I do travel 2 hours so that I can get good quality imaging. And so when the doctors like it and prefer it, it's worth the drive of 2 hours.
They're really friendly, really nice, very helpful. It was I really did have a good experience here.
That's going to wrap up this edition of Best Docs Network, the show that's featuring some of the best doctors in the Dallas-Fort Worth area that are really making a difference in people's lives. And for more information, just head to our website. It's bestdocsnetwork.com.
And if you have a question or comment for us, we'd love to hear from you. Send us an email at info@bestdocsnetwork.com.
Thanks for watching, and we'll see you next week.